Hello, my name is Nicholas Cohen. I'm a primary care doctor with a practice in downtown San Francisco. I created HealthScore, and I'm so glad you're participating in this program. HealthScore is a comprehensive program to optimize your health and extend your lifespan. In my over 10 years of practice, I've been able to help improve the health and extend the lifespan of thousands of patients. Now, HealthScore is available to you and the general public, to anyone who wants to optimize their health and extend their lifespan. Let me give you some background. This is a graph of lifespan comparing the United States with other industrialized countries, going back from 1995. Lifespan in the US over the past decade has reached a ceiling. In every other industrialized country, citizens are enjoying ever-increasing lifespans. Many people think the fault is in our genes and healthcare is our salvation. I meet with patients daily to discuss their health. My patients who report a history of heart disease or cancer, diabetes, high blood pressure, or elevated cholesterol in a mother or father, they assume that such problems run in the family and assume that these conditions are their destiny. If their parents have diabetes, it's just a matter of time before they develop diabetes. And the thing to do is to keep an eye on the laboratory results and be ready to take insulin or blood pressure medication or a statin medication. But otherwise, they assume the problem is inevitable, and there's nothing they can really do to change that. It's just a matter of catching it when it occurs and treating it with medication. But in fact, the most important contributor to health is individual behaviors. If your mother or father have diabetes or high cholesterol or high blood pressure, more than likely the cause is not a gene, but a lifestyle factor. If you inherit the condition, more than likely your parents have passed along that lifestyle factor rather than a particular gene. With this understanding, there is so much that can be done to prevent the condition in yourself. And even if you do have genetic predisposition to a condition, a predisposition is not a diagnosis. And you can drastically reduce your risk by modifying your behaviors. But why modify behaviors, you might ask? Can't healthcare just detect the problem when it occurs and treat it with a medication, basically making it go away? Many patients I see do believe that what they do in the 364 days each year that they don't see me isn't really that important. Optimal health, they think, means going to their annual physical, getting the tests done that I ordered, and taking the medications that I prescribe. The assumption here is that what I, as their doctor, do for them on that one day of the year can protect them against anything they might do in the 364 days in between. In fact, the US healthcare system was designed to treat acute illnesses and infection, and is now only coming to terms with the fact that most of a person's health is determined by what they do in the 364 days they're not seen in the doctor's office. The procedures and treatments and tests we have at our disposal as doctors, like medication, pale in comparison to the impact of a healthy lifestyle. Let's say you're now convinced that what you do each day is the biggest determinant of how healthy you are and how long you'll live. Believing that your behaviors are important is not the same thing as knowing which behaviors to adopt. That's because health advice is confusing. Popular gurus trying to promote their proprietary products and the media trying to grab your attention with headlines provide an ongoing, endless stream of contradictory opinions on how to be healthy. From paleo to keto, from low inflammation to only red meat, we are constantly bombarded with the advice of the week, and it's hard to know what in fact to believe. The problem is that trying to make money off of health advice or trying to draw eyeballs with headlines leads to a lot of information that doesn't meet rigorous criteria for valid scientific evidence. In response, I created HealthScore. I went to the medical evidence. I searched only the best evidence, top-tier peer-reviewed medical literature of studies and meta-analyses published in the last 20 years, identifying factors proven to significantly extend lifespan. I continue to conduct periodic reviews of the literature to make sure the evidence I'm providing here is up to date. My intent is to provide you the best evidence for life extension and cut through the nonsense of popular gurus trying to make a buck on proprietary products and contradictory media headlines toting the fad of the week. HealthScore is based on 31 recommendations in 4 domains: psychological health, sleep and activity, nutrition, and your numbers or biometrics. These 31 recommendations have the most evidence for extending lifespan. In HealthScore, I review each recommendation and share with you tips that have worked for me and thousands of others to incorporate these recommendations into daily habits in their lives. I will share these tips with you to help you implement these recommendations in your life. I'm on this journey with you. All of these factors and all of these behaviors are ones I practice daily. And I share with you what I've learned and what I continue to learn from other patients in my practice. If you get these 31 recommendations right, you can have confidence that you're doing all that medical science knows possible to extend your lifespan. Welcome to this course, and thank you for joining. Let's get started.